Hello, hello. I hope you guys are doing well. It's Dr. McJunkin here. I'm going to talk about something that's been a requested topic for us, and that is urinary retention. So, we're going to talk about urinary retention, what it is, how it affects people, and what you should do about it if you have something like that. So, let's kind of jump right into urinary retention. Um, as you guys remember, I specialize in a specific procedure called sacral neuromodulation. It's used primarily for people with overactive bladder, but it's also an effective treatment for a specific kind of urinary retention. And so I'll talk to you about that a little bit. But first of all, what is urinary retention? I think most people, a lot of people, it's very, very common, but a lot of people experience some version of this. And unfortunately, it becomes much more common as we age. It's actually more common in men than women, um, but obviously it can affect women as well. And the statistics are pretty interesting. So it affects about 10% of people over the age of 70 and then becomes up to about 30% of people over the age of 80. So it's actually really, really common. But basically, it's where your bladder is not able to fully empty all the way. So you might pee, and then so I hear this very, very commonly. Like I'll go to the bathroom, and then right when I'm done, I have to go to the bathroom again. So remember, your bladder is a storage container that holds the urine. And so there's different reasons why the bladder might not be fully contracting, or probably more common is obstruction, where the bladder is trying to contract, but there's something obstructing the flow of urine out of it. So, what are some of the signs of it? Difficulty starting to pee. So men oftentimes with an enlarged prostate will get a lot of these things. My stream's not the same as it used to be. It's very difficult for me to get the stream going. It's a weak stream, not like when I was a young man. And then, what I will hear in men and women, but feel the need to pee kind of right after you've just peed. So, overactive bladder can also give that similar symptom where you feel like you're going all the time. And there are a lot of people who have kind of the mix of these two things, urinary retention and overactive bladder. So today we're going to focus more on that urinary retention piece of it. It also, you feel like you always have to pee, so, which is also common for overactive bladder. You feel like you're going all the time, or that's called frequency. And then nocturia is going multiple times at nighttime. So again, those are a lot of the same symptoms as overactive bladder, but those are manifested differently for the people who have urinary retention. Okay, what causes it? So probably the number one cause is a blockage in the way that the urine leaves your body, and we could say leaving the bladder itself. Other things that can cause it, though, and we'll talk about some of these things. What are some of those blockages? Certain medications. So if you're having this problem, you want to look at your medicines and make sure that they are not causing this issue. Nerve problems, which can include neurodegenerative conditions, spinal cord injuries, or things even like strokes. Those kinds of things can change the way that our body regulates how we have to pee or empty our bladder. And then there are things that are maybe more temporary, like an infection, a UTI. You might have swelling, or even you can have an obstructive thing that would be more temporary. But an example of that would be if you had some kind of a stone, like a kidney stone or something like that, that went down and was in the ureter and was making it difficult for you to pass it, or in the urethra. Okay, so blockage, let's look at that. Number one thing, especially in males, enlarged prostate. Certainly you can also get prostate cancer would be another thing. Enlarged prostate's the very most common. You can also have a bladder outlet obstruction. And so that, again, we just kind of mentioned one of those versions of that, a ureteral obstruction, so like a ureteral stone, a blood clot, a tumor, some other factor. And then we also will see things like a cystocele, where your bladder actually is coming out. It's like a hernia of the bladder, and it's pushing up against there. And so it's maybe kinking the neck there where the urine doesn't pass. A rectocele is where the rectum is kind of herniating out. Um, and ureteral stricture is a little bit more common in men than it is women, and sometimes that'll relate to prior infections. So you get some scarring that takes place in the urethra, and then you have swelling there as well. So, if you are struggling with the symptoms, I would say if you're a man, the number one thing is to get your prostate checked out. If you are a woman, you want to make sure that you don't have a cystocele, rectocele, or some kind of stones like that you're passing. Those would be the more common things. Let's look at medications that might be causing these. There's actually a long list of medications, even some over-the-counter medicines that can cause urinary retention. Very common ones would include things like Benadryl and other antihistamines. So some people, remember, will take those at nighttime. And so that can cause a retention kind of problem at nighttime. Antispasmodic drugs, and so those are actually like the overactive bladder drugs, like Detrol. And so those are supposed to calm down spasms in the bladder, but they might prevent the bladder from fully contracting, and so you can have what can become an emergency. So if you're not able to empty your bladder at all, that's obviously an emergency. And if you have that condition, you should go to the hospital. Oftentimes they'll put a catheter in and release that urine, and then they kind of figure out from there. Other common medications include narcotic medicines or opioid medications. So those will cause and can cause urinary retention, and those can also cause constipation. And then a really common class of medicines are the tricyclic antidepressants. Those medicines are like Elavil or nortriptyline. Those also can prevent your bladder muscle from working properly. This becomes very tricky for people when they have both of these conditions. I saw a gentleman just a few days ago, and he had overactive bladder where he's having spastic conditions with his bladder, but also he had retention. And so he was on a couple different medicines for to calm down the spasms, but unfortunately that may make the retention actually worse. And so oftentimes you might have to go through one medicine at a time and look it up and see if it might be one of the things that's causing your problem. Some other blood pressure medicines can cause urinary retention. Some psychiatric medicines can cause urinary retention, and then some muscle relaxants. Obviously, those are calming down the muscles. Let's look at other issues that might be causing urinary retention. And I mentioned this briefly, but nerve issues. So, if you've had a recent stroke, diabetes, multiple sclerosis, even things like Parkinson's, those things can affect how well the signals get transmitted from your brain through your spinal canal or spinal cord down to those peripheral nerves. How about traumas, accidents, falls, those kinds of things? When the nerves are purely injured, that can also cause retention. One of the classic things that we'll see where you have these bladder issues is if somebody has a spinal cord injury, all of a sudden those signals are really not going through. Pressure on the spinal cord from a herniated disc, that might be something you wouldn't think about, but a lot of people with back pain struggle with urinary issues. And even things like tumors and those kinds of things obviously can affect how well the nerves are working. Some women after vaginal childbirth will have some trauma to the pelvic floor and to those muscles and particularly nerves. And then there's different kinds of pelvic surgery, and this is a common one that I hear. They were in there fixing this, and all of a sudden I developed this afterwards. We have talked in the past about the treatment of Botox that's used for overactive bladder. That obviously is a neurotoxin. You go inside the bladder, inject 20 different spots with Botox neurotoxin. That can cause urinary retention because now the nerves are damaged and the muscle's not working properly. I also mentioned this prior, but infection or swelling, so things like prostatitis. So you might not have just you might not just have an enlarged prostate, but you might have an inflamed or irritated prostate. Urinary tract infections obviously can, and then sexually transmitted diseases can also cause inflammation, scarring, those sorts of things. It's very common after surgery for people to have difficulty emptying their bladder, and one of the requirements, oftentimes, for you to leave the hospital is they want to see you pee. And that's because nerve blocks like spinal epidurals or spinal blocks, general anesthesia, all those things can cause urinary retention. Generally, that's a temporary thing. What are the risk factors? Well, the risk factors really are age. So specifically for men, enlarged prostate as we age, that just becomes a much more common issue. And then any neurological issue would be a risk factor as well for men. For women, aging is also a risk factor. What are some of the complications of urinary retention? Well, obviously there's the emergency complication where if you are not able to empty your bladder, you can actually have a ruptured bladder and then have all sorts of problems from that. But some of the more common things we see for people who can empty their bladder, but just maybe aren't fully emptying their bladder, is urinary tract infections. That urine stays in the bladder, doesn't have time to fully empty, and it starts to build up bacteria, and then you actually start to build up what's called biofilm. But it's this film that lines the bladder wall, and it's really difficult to get rid of that film. So these people are prone to getting more and more UTIs. Bladder damage, and so we hear this commonly for people who work shift work or nurses or doctors, where they have to stand there, let's say performing a surgery for 12 hours. You might be damaging the actual bladder itself when it's getting so full. And then a lot of people with spinal cord injuries can't feel the bladder. So their bladder might get so full that they're actually damaging the muscular tissue. Kidney damage, because what you have is you start to get a backup of urine that goes to the kidneys, and that can affect the way that the kidneys themselves work. Okay, so how do you work this up? How do you test for this? There's a lot of different things that are done. Generally, we always start with a medical history, physical examination. You might look at a urine sample to make sure that you don't have an infection or something like that. For men, there's the prostate examination to check if it likely is an enlarged prostate. I would say most people have undergone those things who are struggling with urinary retention. If this is an acute issue, you just developed it, it just started, you should go to the hospital because it can be an emergent issue. There's some more specific tests that are done. Post-void residual urine test, that's essentially an ultrasound. There's two ways to do it. One is an ultrasound that you go pee and then you ultrasound and look how much urine is left. The other way to do it is you go pee and then afterwards you catheterize yourself and see how much extra urine comes out. Cystoscopy is taking a direct visual inspection. Little scope is placed through the urethra and then you go into the bladder and look for maybe an abnormal bladder cancer, any kind of damage that one might have. And so sometimes you'll be able to see obstruction. So for men in enlarged prostate, you might be able to see an obstruction coming in and know, the problem that they're having, the retention they're having is coming from this enlarged prostate. Coming into that space, urodynamic testing, and then in men, the PSA blood test or prostate-specific antigen is oftentimes a screen for prostate cancer. But that can also cause retention. So what do we do for urinary retention? Part of it is trying to figure out what's the underlying cause. Again, the most common cause is obstruction. And so for men, you're really focusing on, is this the prostate? For women, you might be looking at other potential issues. Are you having erectocele, cystocele, something else? One of the simple things is to look at your medications and see if maybe you're having a medication side effect or medication interaction. Now online you can go and put all your medicines into certain databases and it'll tell you if there's interactions. Sometimes surgery might be required. Sometimes there's behavioral changes. Oftentimes, if there's no particular, so oftentimes let's say that for a man we figure out, you have an enlarged prostate. You need this prostate, intervention. Let's say you get a TURP or a Urolift or something to open up that narrowing. oftentimes men will still struggle, and then we'll figure out, you know what, now your bladder's not functioning properly. Maybe your bladder's been damaged. So it's no longer an obstructive problem. Then we start to look at other things. Is there medications that would help? And then that's actually kind of where, it comes in what I do, called sacral neuromodulation. So sacral neuromodulation, before I mention that, I'm going to talk about some of the other kind of conservative things, because this might be what you start with. If you have an infection, obviously you might start an antibiotic, try and get rid of the infection. For an enlarged prostate, oftentimes men are on alpha blockers to try and open up the flow. If it still is not working, oftentimes surgically you'll go open up the flow. For cystocele, rectocele, or for kind of like those hernias that might be pushing up against the bladder, you might have to have surgery for that. Oftentimes physical therapy is recommended. If you have urinary tract stones, then you might have to have a specific kind of intervention to try and break those stones up. We still talk about Kegel or pelvic floor exercises. And again, it's really difficult to actually contract the bladder muscle, and that's what this problem is. So let's say, one of the things that we do, that I specialize in, is sacral neuromodulation. I will say right off the bat, in my experience, this maybe works for about half the people who have urinary retention. It's not quite as effective as overactive bladder. Overactive bladder, this therapy works in about 93% of people. For urinary retention, though, I think usually it helps about 50% of people. I'm looking at an article right here called Sacral Neuromodulation for Non-Obstructive Urinary Retention. So again, you wouldn't use sacral neuromodulation for a person who has obstructive urinary retention. This article looked at, it's a meta-analysis, so it looks at all other articles that have been written and then tries to collate the data and says whether or not this is beneficial. This article looked at 14 other articles and studies and tried to figure out what were the best studies that were out there. How much does this help people who have this problem, urinary retention? Should it be done? Their conclusion is, based on the available literature, sacral neuromodulation is an effective therapy for treatment of non-obstructive urinary retention. And I would say I agree with that. Oftentimes what it leads to is the bladder, and again, sacral neuromodulation is the use of electrical stimulation to open up that bladder pathway and the communication between your bladder and your brain. And what it does is help that bladder to more fully contract in a coordinated fashion with your brain. So I have seen success with this, certainly. For people, oftentimes people will be cathing themselves if they have full urinary retention. So there's partial urinary retention where I think sacral neuromodulation might be able to make a significant difference, and that person may not need to cath. But cathing yourself, oftentimes we'll see people catheterize themselves 4 to 6 times per day. So what we see with sacral neuromodulation is oftentimes the cath, if they can go at all, the volume that they go on their own would be more. The catheterized volume would be less. Oftentimes people want to go, their goal, let's say they're cathing 4 times a day, their goal might be, I don't ever want to cath again, I hate this. I don't know if that's an actual, a legitimate goal with this therapy. I think this therapy might be able to improve how much you can actually urinate. But the beauty of this therapy is you can try it and see what it does for you. So on the people that I have with urinary retention, some people have that goal of I want 100% relief. I would say, we'll try it. I don't know if you're going to get that. Other people are like, hey man, I'm going to take anything that will improve my quality of life. I would say that second group of people that want their quality of life improved, they generally will see a strong benefit with this. The people who are 100% or nothing, I don't think, and I haven't seen in my own practice that this gives you 100% if all you're doing is catheterizing now. Okay, let's see. So I saw a couple comments about specific cases of urinary retention. And, you could see just from our discussion that urinary retention can be really complex. because you can have obstructive problems that come from all sorts of different causes, whether it's the prostate or whether it's cancer or whether it's an infection, whether it's just straight inflammation, whether it's scarring and a stricture, or a cystocele, rectocele, where the tissue has actually changed. All of those can cause the same kind of picture. Really sacral neuromodulation is for when those people have been treated and they're still having issues. That's when we generally will consider sacral neuromodulation for those people when they're no longer obstructive. If you have more of a neurological condition, usually that's not an obstructive condition, and I would say those are the people who tend to do better with sacral neuromodulation. I hope this was helpful and informative for you, and I will put a link to that research study that I talked about. It's a study from 2010. And I hope you guys are all doing really well. I'd love to hear your own stories with urinary retention. Urinary retention is a very difficult issue, and I think it makes for a more difficult quality of life, and I'm sorry for anyone who's suffering with that. And I want to give you hope, and hopefully you'll find the right intervention that helps your condition. If you're interested in trying sacral neuromodulation, I certainly have seen it help many people, but like I mentioned, I don't think we're likely talking about 100% relief. It likely will be less than that, but the beauty is you can try it and see if it works for you. All right, guys, God bless you guys. I'm going to be gone for just a couple of weeks. I'm going on a medical mission trip with my family to Guatemala, so I won't be doing these kind of updates there, but I'd love to hear what other issues do you guys want to discuss. And I'd love to hear your own experience and stories. Please leave those in the comments. Thank you guys. God bless you.